Good afternoon, everyone. Before I begin, I'd like to thank, of course, the organizers for this event, the Konrad Adenauer Stiftung, GSM Institute of Governance, and Galing Pook for this very relevant and timely occasion to talk about how far we have progress or in terms of, particularly in the context of local health governance. Um, what I'm gonna share today, I'm gonna highlight the role of a incident command system as a mechanism for local COVID-19 response. Basically, this takes off from one of the recommendations that we made in a policy brief that we issued in April, um, and in that particular policy document, we recommended a number of we made a number of recommendations, including the possible response mechanisms. And the basic one of the basic arguments we have there is really the point that and as far as managing or responding to the crisis itself, we are not lacking for existing mechanisms. It's really just a matter of tweaking what we already know and practice, particularly from the perspective of disaster and crisis management. So the document, you can download it through the DLSU JRIG website provided below. And as mentioned by Dr. Ador, we will be coming up with a book out of these different policy briefs. Let me just start off with this one, that when we look at the crisis, we look at the pandemic, we look at it as a form of emergency or even a crisis, and particularly in the context of how it more or less covers different aspects of our lives. We look at it as a complex emergency, and not just a public health issue, but also as an economic, as an issue with security issue and so on. And there, because of that, it entails a lot of other political considerations. That managing it, while it's relatively quite straightforward what we want to do with the pandemic, it's not that easy to sort of like implement interventions, primarily because of the different facets of the crisis. And as we have seen, as of yesterday, we have already about like more than 300,000 cases, and almost 50,000 active so far. And just to demonstrate the severity and the need for urgent action. And you can see below the graph, you can also see the graph where we show the different our trajectory, especially even with respect to your recovery. And most of these cases, of course, we know are in the cities, Philippine cities. About 67% of the total cases are in cities, and a big bulk of that, even in terms of the active cases, a big bulk come from cities, primarily in Luzon. And so the question now is, how do we actually manage something like this, a crisis that's practically, as mentioned by Dr. Adol, not exactly new, but also in a way it's new in terms of its magnitude, and also because of the nature of the virus itself that's practically novel from a standpoint of managing the spread. But still, in as far as disaster or crisis management in the Philippines, as I've said, we're not really lacking for systems. In fact, the Republic Act 10121, or the Philippine Disaster Risk Reduction and Management Act of 2010, already acknowledges it covers epidemics as part of how we define disasters. In fact, epidemics are one of the preconditions for the declaration of a state of calamity. And the state of calamity declaration is needed for us to be able to tap, for example, our local DRRM, disaster reduction and management funds, at the local and national level. So we have actually, if we think about it, we could have utilized, even using the RA 10121 as a basis for responding. And as provided for in the said law, we have a ladderized structure from the national all the way to the local barangay level. We have the National DRM Council to provide policy direction and strategic guidance when it comes to dealing with different kinds of disasters, mostly natural hazards. But as I've said, I indicated the natural hazards class because the truth is actually the law also covers other hazards, as I said, including epidemics. So this kind of setup under the RA 10121, it goes all the way down to the barangay level, and we have that. We've had that since 2010. On the other hand, we also have another policy instrument, the Executive Order 82, which prescribes structures when it comes to managing crisis. And when we say crisis in the context of that particular policy, it's in the nature of what we call as man-made hazards or man-made induced hazards. Like for example, what we've seen in Marawi or in Zamboanga in the past and so on, including even something like bioterrorism and so on. So we have a structure for that with the National Security Council on top as the chair of the National Crisis Management Committee, and the same structure is scaled down all the way to the municipality level through the public order and councils at the provincial, city, municipality, and at the regional level. So we have that. Now, when it comes to epidemic itself, in 2014, before that, we have the incident command system. Both policies actually prescribe the use of what we call as an incident command system. It's a kind of a hierarchical structure for managing different incidents, including emergencies and disasters, large-scale disasters. And both policies prescribe the use or the need to do contingency planning or the use of incident action plans for that matter to guide the operations of the incident command system. Now, when it comes to epidemic, what we have is EO 168 adopted in 2014 in the aftermath of the SARS, MERS, and Ebola outbreaks at the time, and particularly it's meant to address future risks that could come from biological hazards, or particularly the emerging infectious diseases like what we have now. And in that particular policy, it has identified the DOH. Of course, it established the interagency task force, the IATF, which is what we have now, and also it puts DOH at the center, at the core of the functions of the IATF. But unlike, for example, RA 10121 or EO 82, EO 168 does not explicitly look at epidemic as a decentralized local concern. So that's why if you look at the letter of the policy itself, it only mentioned about DOH having the power to actually tap LGUs and other entities to assist in the addressing an epidemic. And also, it did not refer to the incident command system or the contingency or planning process. So how have we responded? Of course, we all know this already. As early as January 28th, the IATF was activated, and a few days after, the DILG also issued a memorandum to all local government units, designating the role of the local chief executives in relation to COVID. I will go to that later in the next slide. And then between January 28 all the way to March, by about March 25, that's the time when we started March 25, we created a national task force, supposedly as the implementing arm of the IATF, as the IATF eventually was relegated to or became the more or less the policy-making body, and the NTF, the implementation unit. And again, sometime in April, as part of the NTF, there was the mandate to um, create the local task forces at the provincial, city, and municipal level in April 24. So what we have basically in the said task force, it designates the local chief executive as the head, and all the other and several other officials as members. And it also designated or created different teams: contract tracing, diagnostics, patient management, and logistics and resources. But as I've said, before that, in January, the LCEs were also designated, given the functions, to serve as the information manager, the local crisis manager, and the environmental health manager. So all of these things are within the responsibilities assigned to the LCEs as a result of COVID. Now, what I would like to highlight really is that what we pointed out in the policy brief is that we didn't really have to invent or look for new structures, because while the memorandum circulars, for example, or the directives from IETF related to the role of LGUs, while they were quite clear as far as the roles are concerned, it did not specifically mention how LGUs are supposed to roll out their responsibilities. And one option that we presented in the policy brief really is the use of the incident command system as a platform for LCEs or for LGUs for that matter to manage the crisis. And the ICS is really it's a universally accepted standard or practice when it comes to responding to emergencies and disasters. It's quite not exactly very old, 1960s, 70s. It started during that time, but it has been adopted by many organizations, national agencies, local government units all over the world when it comes to how do we actually respond to emergencies or even incidents that are not necessarily disasters. And what is unique about this particular system is that it allows for the use of common terminology. It tries to integrate different communication channels to ensure that there will not be miscommunication or lapses in communication throughout the response operations. It also provides for a unified common structure to avoid, let's say, confusion or duplication in efforts, and as well as it provides a system for planning the actions to in terms of managing the crisis. So if you look at it, it can be something like this. We have at the strategic level, we can have the LDRR, the existing LDRR-MC, or the local Disaster Risk Reduction Management Council, or in some cases, the local Crisis Management Committee. It depends really on the LGUs. Some LGUs have activated their CMC, others have activated the RRMC, others have not activated it at all. But the point is, we have these existing structures that we can use to sort of like provide policy decisions, and also use as a fulcrum for, let's say, higher level coordination or coordination with the national government agencies. So that will be the body at the strategic level. And then the actual operations can be handled, for example, by the LDRRM office, which of course by law should have their own operation center. They will be the one that should be able to monitor the situation and mobilize resources and coordinate the different requirements, logistic requirements for the response. And at the tactical level, at the ground, we can have the incident management team that will be, of course, headed by an incident commander, and that's where we will have the different response clusters Uh, and all of these things throughout the process, they should be guided by either a contingency plan for an epidemic, if we have one, or if none, then in an incident action plan. And so if we, in terms of as a structure, we can look at it this way. You would still have the local chief executive as the chief, as the responsible officer, as chair of either the LDRRMC or the LCMC. But what is important here is, for example, to have, let's say, the health officer or the provincial, city, or municipal health officers, the incident commanders, the one who should be calling the shots, because this is primarily still, after all, a public health issue. So they should be the one to serve as incident commander. And then what is also unique about the ICS setup is that, it's highly flexible. You can designate, of course, an information officer who should be able to deal with the media and coordinate all the communication concerns. And at the same time, you can tap the resources of the local DRRM office, especially when it comes to the operations, the response part, because our LDRRMOs, many of them are, they have already a way of developing or mobilizing different response clusters. I mean, we have been training for ICS in the Philippines since 2010, and and even we have developed also a response cluster system following the UN humanitarian setup. And these are the things, both ICS and the response clusters, that are our LGUs mostly are quite familiar with. So it's really just a matter of mobilizing. And so if you think about it, the possible response clusters that we usually mobilize in times of disasters can also be mobilized in terms of the current crisis. You can see the green ones, these are the usual, plus the health. So you have health, law and order, relief, logistics, the management of the dead, and camp coordination. In our context, maybe isolation facilities, the management of isolation facilities, and so on. But other LGUs have also developed or created additional clusters, like a local economic cluster, or even the specific cluster meant to manage, for example, the returning overseas Filipinos or locally stranded individuals, and so on. And under the health cluster, that's where we would have the different teams. So what I'm trying to say really is that under an ICS setup, we can have a more or less systematic and consistent way of responding to the pandemic at different, across municipalities and cities. So lastly, these are just some of the advantages of using ICS. For one, it establishes a clear chain of command. Primarily because you have just one incident commander, and there's a clear line of delineation of roles as the responsibility moves from the tactical, operational to strategic activities. And also it allows for the use of standard terminologies and clear communication lines, because in many emergencies in the past, what we have seen really is that some of the key issues are not really about resources, but it's more about communication and management, and that has been those two aspects have been the Achilles heel when it comes to disaster management. So it's important, and that we can address those weaknesses, and the ICS can provide solutions for that. Of course, the tricky thing is that we cannot just mobilize and adapt ICS, right off the bat. It's something that we have to prepare for in advance. We have to have, number one, we need to have the political buy-in, of course, and also the official adoption by a local government that they're going to be using ICS for their crisis management operations and so on. And yet, if it needs the training of people on the ground, staff from not just from the local DRM office, but all the other units within the local government unit. Because the beauty of ICS and also its challenge is that you will be coordinating with not just one unit but with different agencies, and so it needs prior orientation and training from all the relevant units within the LGU. And of course, it goes without saying that there has to be some kind of a planning exercise beforehand. Or if it happens, at least we have people who are accustomed or familiar with how to do incident action planning as a particular, as an emergency or disaster unfolds. I think that's it. That's the end of my presentation. Thank you very much for listening.